going to be doing dermal filler. I'm going to use a product called Restylane in her tear troughs, and I'm going to be doing her lips. So right now I'm prepping the skin with a little alcohol. I want to get the tissue nice and clean. Restylane is a dermal filler that uses hyaluronic acid, which gravitates towards water, and it pulls water into the tissue and makes it plumper. Your body actually naturally makes it, so it recognizes it, and it makes it a very safe treatment. It'll last about 6 to 9 months, sometimes up to a year. When you probably hit about 25 to 30, we start losing our collagen and elastin. Everybody's different, so we do offer free consultations here at Olive Tree. So the benefits of filler and injectables in general is to not only help the appearance of aging skin, but to help prevent aging. So it's really a nice treatment all the way around to start doing at a younger age. A lot of people think they need to wait until they're a certain age, like 50, I should probably start doing filler, and that's not true. We kind of want to start when the collagen and elastin starts to decrease, like I said, which is around 25 to 30. So the reason I'm using Restylane on her today is in the tear trough area is because I found over the years that it's the nicest filler to put in this area. It doesn't cause a lot of lumps or bumps. It goes in nice and smooth. It's a pretty thin filler. We want to keep lip fillers nice and conservative. The big look is not in despite what's out there. So we want everybody to look very natural and youthful looking. So I'm doing what's called a pinhole technique. And we're just kind of building a fence post of filler to pull this tissue up. And you don't need a lot of filler to get good results. So you're pretty swollen after lip injections, but it goes down pretty rapidly in about 48 hours. Olive Tree has been open for nearly 7 years, and we are actively growing. In December, we're adding on hormone replacement therapy, so we often have different treatments all the time. I think what makes us stand out is all of our nurses are really caring people outside of being extremely artistic. And we try to do conservative treatments. We don't want people to look overdone. They're constantly coming out with new fillers, so we're always learning about what the new treatments are. And I think that's also what sets us apart from other places, because some places just use the same old stuff. And we're always after what's gonna make people heal quicker, look very natural. So what we look for after we're done with filler, smile for me, Gina, is we're looking for symmetry. Are the lips nice and straight across the teeth? Which they look pretty darn good. I can't feel them, so I trust you. What's nice about filler, aside from it being very safe, is if you didn't like it, we could always remove it. It's a very simple procedure to do that. Okay, so for this next part, we're gonna focus on her tear trough area. She's got really nice apple cheek smile for me. So I'm gonna put it in relax. We've got a little bit of volume loss right here. So I'm gonna go in and I'm just gonna kind of plump this up. I'm also gonna put a little filler on her zygomatic bone to kind of build up this back part of her cheek. And this is gonna kind of help hold up this tissue because it's starting to fall and creating some nasolabial folds. So we are injecting this filler using an aliquot technique, kind of like a Hershey Kiss, and we are putting that on the periosteum. And so it's going above or beneath the dermis to push the skin up and to help create that lift. And as you can see, we've gotten a nice little lift on the zygomatic bone. So I am a firm believer in telling people with getting filler, you're gonna have to expect some swelling and bruising. We're playing with needles, so they are going and they're entering into the tissue. Oftentimes I'll get people who ask about bruising and they think that they've watched some sort of a YouTube video and they said they didn't get bruising. And that's just not the reality of how these things work. There is some downtime to it, not much. As far as you can see, it's not like it's a horrible amount of bruising and swelling, but you cannot expect that those things will occur. This is called an introducer needle, and I'm going to use what's called a cannula technique to do Gina's tear trough area. This is the safest way and the most effective way to treat this area. Without a cannula, it's a little bit higher risk of bruising and causing a vascular injury. So that's why we always want to use a cannula when we treat the tear troughs. This is what a cannula looks like. It's a blunt tip needle. So that way when I go in, I can smoothly lay that filler down and without getting any lumps or bumps or creating a vascular injury that we're always worried about in the tear trough area. Consultations are free. We usually make time to get the procedure done that day, or we can just do a consult. There are no obligations. Yeah, I think a lot of our patients that come here kind of feel like they're, as cheesy as it sounds, family, because they've been coming for a long time. And we really get to know everybody on a personal level, which helps us treat them aesthetically.
That's insane.
TearTroughSlipBalm.com.
Wow.
So everybody gets a little post-care kit after they get any sort of treatment done here. So this is our filler kit, and inside of it, since she got her lips done, she does get our Image lip balm, and then a little ice pack, and instructions. And if anybody ever has any questions, they can always call. We do have a nurse that's on call. A chapstick, a little sample of arnica, which helps with swelling and bruising, and then a little sample of one of our featured products that we're selling in the month that you get your procedure done. So we are back 3 weeks later here with Gina, our model. We did some filler in her cheekbones, under the tear trough area, and we also did her lips. So she's all healed up. And actually, we do like to say that filler does take a full month to peak, but we do get people back in 2 to 3 weeks later after we've injected them. And how do you feel how the healing went, and how do you like your procedure?
Oh, wonderfully.
Good.
It was, I mean, within a few days, everything goes down and you start to see the full results of what you could have had in your mind. So, yeah, no, I mean, pain was good. It wasn't even there. So,
good,
yeah.
Good deal.
Yeah,
and
makeup on is like a whole new.
Yeah.
It's a young person.
Very nice. Yeah, and so how do you feel like your healing went? Did you have a lot of bruising, swelling? Tell us about that.
I honestly didn't have, swelling was minimal, like
Okay.
up and through here, but that went away almost the next day.
Okay.
Lips, there's like the little like injection, like dot bruises,
Sure.
but nothing that didn't go away in 2 days.
And that's pretty common. Lips tend to be the most swollen out of anything we inject here at Olive Tree, but they do heal pretty quickly because it is a vascular area. Well, great. We're glad that you came back for your follow-up, and then we'll post our before and afters with you online.
Wonderful.
Thanks.
Thank you.